It cannot be a coincidence that most of the people I know who have died by suicide used a gun. The simple fact is this: where there are more guns, there are more firearm suicides. People who reach for guns in these moments of crisis rarely survive. In fact, guns are used in only 5% of suicide attempts, but because they are so uniquely lethal, they are responsible for over 50% of suicide deaths. This fact cannot be ignored. And it wasn't until I was reading Malcolm Gladwell's book, Talking to Strangers, that the light clicked on in my brain. Gladwell discusses the importance of context in understanding human behavior. The incidence of suicide is a coupled behavior, a product of intention in combination with context. Herself, like 44% of all other suicides in England and Wales that year, she used the lethal town gas in her oven that contained nearly 20% carbon monoxide. By the time that gas was fully changed over to natural gas, which only contains 0% carbon monoxide, in 1977, the number of suicides, not just suicide by gas, plummeted. And when there was no longer an easy, accessible, socially acceptable way to kill themselves constantly present in their homes, people stopped dying by suicide. Of a stranger who committed suicide. But suicide is a coupled behavior. It tells us more about the world in which the stranger lived than about the character of the stranger themselves. Coupling theory can make us better understand and prevent suicides. If suicide is coupled, by removing access to the most used lethal means in the short time span of crisis, suicide can be prevented in many cases. The Golden Gate Bridge is the most jumped off bridge in the nation, and over 95% of the people stopped from jumping off of it don't attempt suicide again. The most lethal means used in Wisconsin suicides are firearms, which are used in over half of all suicides. Most of these deaths were among rural white men ages 45 and older using firearms that they already have in their homes. Current efforts in Wisconsin to prevent suicide in rural areas have placed an emphasis on increasing access to mental health services. While mental health access programs for high-risk groups and rural populations as a whole are an important piece to the complex puzzle of rural suicide, they are primarily focused on connecting people with healthcare providers who may not be prepared to provide the necessary screening and counseling on firearms as lethal means and risk factors for suicide and gun death. However, research shows that when clinicians take the time to screen for and counsel on firearm storage, with concerns for health and safety at the forefront of the conversation, patients make changes in their firearm storage practices and reduce access to firearms. Being prepared to non-judgmentally talk to patients and offer tangible solutions is key. It isn't about convincing them to give up their guns. Are left shouldering so much of the screening and education for firearm safety. Yet, many have received little training on how best to do so or aren't sure of local resources available to direct patients towards. My project worked on taking some of that burden away. Together, I hope we can make firearm suicide a thing of the past, as the British did with their town gas. And it's not hard to imagine. By uncoupling transient suicidal feelings from easy access to firearms, we can be a part of the solution to firearm suicide.